Nina. So for video assignment, the blood disorder that we have chosen is myelofibrosis. Our video would have a mixture of a documentary as well as a short movie. We have adapted based on a common case found in Malaysia, where a 81-year-old mountain climber was diagnosed with myelofibrosis. Based on his journey on myelofibrosis, our group and I have adapted his story and created a short roleplay. So stay tuned and watch.
His name is Tan Sri Chan Chung Tak. Among his many accomplishments are the Malaysian Book of Records titles as the oldest person to reach the top of two mountains, which were Kilimanjaro's Uhuru Peak on 31st August 2003 at age 70 and Kinabalu's King George Peak on 29th August 2004. Chan discovered he had myelofibrosis after his wife, who picked up on his abnormally high platelet levels from a blood test he had done following an accident in 1993.
Myelofibrosis is commonly known as myeloproliferative neoplasm. It is a grave and serious bone marrow disorder. It disrupts the normal production of blood cells in the bone marrow by replacing the bone marrow with fibrotic and scars. Bone marrow is the site of production of all body's blood cells. By having scarring in the bone marrow, thus, it is definitely not benign. This can eventually lead to serious complications, shortening of lifespan, and problems with cell count. Myelofibrosis is considered as a type of chronic leukemia. It is a cancer that influences the blood-forming tissue in the body. Myelofibrosis occurs when the blood stem cell undergoes genetic mutation in the most common mutated gene, which is the JAK2 gene.
Come help me cook lah. Are you okay? You're not feeling well lah. Hey, you're having fever lah. Get up, get up. Why? What happened to you? You okay or not? What's all this? Bruises all over your hands? Fever? What else you have?
I think abdomen pain, bone is paining, I can't breathe. Okay.
Why? What's happening to you?
So past few days I've been having some right abdominal pains, certain fevers and bone pains. Then at times I have really bleeding. So now I also have the urge to sleep a lot. Listen what's happening to me.
Do you have diabetes? How long do you sleep?
8 to 7 hours a day.
After lunch, do you sleep? After your breakfast, I'll write down some tests, read into the test, and then after I got the results, I'll let you know what's the problem. Okay. But I suspect you might have blood disorder. I'm not sure. Let me check the results. Okay. Nurse, please call his wife, please. So, your husband is facing a blood disorder, which is myelofibrosis.
So is there any treatment for this disease?
Yes, finally, there's a few treatments. One is blood transfusion. We have to do blood transfusion 2 months once. This is because you have anemia. So by this blood transfusion, you can cure your spleen is enlarged. So to reduce the size of your spleen, you can undergo chemotherapy or radiotherapy, and I'll give you some drugs, which is a medicine. You can eat that. And the fourth one is that stem cell transplantation. The stem cell transplantation is very crucial as you need a compatible stem cell transplant. So, as my experience, stem cell transplantation has not happened so far. So these are a few treatments. The first 3 treatments, it's better for you to take. Okay.
Where do we proceed to take the treatment?
For blood transfusion, you can just get it from the hospital or prescribe some medicines. And also for the radiation therapy, you can do it here.
Thank you so much. Based on the treatment given by Dr. Vaitesh Gopalani, is that blood transfusion is one of a way to help with myelofibrosis, and this is where National Blood Centre comes in play.
National Blood Centre of Malaysia, also known as Pusat Darah Negara, was inaugurated in April 1972 by the Director General of Health, Ministry of Health. Starting in 1975, the Blood Services Centre has played an important role in the standardization of work procedures, methodology and blood bank equipment in all new buildings. In 2002, National Blood Centre was built in Jalan Tun Razak and was inaugurated by the Director Datuk Sri Hasma Muhammad Ali. The buildings is stately and magnificent to date in ensuring the collection of blood and ensure safe, clean quality. Blood is the most precious gift that anyone can give to another person, the gift of life. A decision to donate your blood can save a life. There are 2 types of blood donation, which is firstly apheresis blood donation, where some patients need only a specific part of a donor's blood, such as platelets and plasma. Machines called blood cell separators are used to draw the blood. Next, whole blood donation, the most flexible type of donation where it can be transfused in its original form to help multiple people were separated into its specific components of red cells, plasma and platelets.
For patients like Palani who suffer from myelofibrosis, he has to wait for a period of time to get a compatible donor for bone marrow transplantation. In this period of time, one has to undergo blood transfusion for every 2 months. Blood bank can help patients with myelofibrosis by taking in extra effort in collecting blood from donors, as patients with myelofibrosis needs frequent blood transfusion every 2 months. Hence, blood bank provides continuous blood supply to respective hospitals who have visited cases of patients with myelofibrosis.